You are listening to The Thought Leaders Show with the world's cutting-edge, hottest innovators, influencers, and impact makers today. If you are looking for inspiration and motivation, listen in. Welcome to The Thought Leaders Show. Now, here's your host.
Hi, this is Tammy Pastor, and I'm excited to introduce today's guest, Dr. Manjula Raguthu. The doctor is board certified in family medicine and anti-aging and regenerative medicine. She has a holistic approach to the patient and the management of disease. She believes strongly in health is wealth. She's been active in practice for more than 26 years. Manjula did medical school in India and her residency in St. Vincent's Medical Center in New York. She currently practices in Houston and Brownsville, Texas. She has many awards to her credit. She's been recognized among best family physicians in America by Consumers Research Council for 2015, 2009, 2006, and 2004. Dr. Raguthu believes that we all deserve a life of vitality and that we have the potential to create it for ourselves. She creates change in the world by elevating people to healthier, longer, and more fulfilling lives, empowering each on their own journey of changing the world. She volunteers for a number of nonprofit organizations. Now listen to this. Dr. Raguthu has received the Distinguished Humanitarian Award, Top Female Executive, Elite American Physician, Professional of the Year, not once but twice, in the Continental Who's Who. She is a Pinnacle Award winner and in the Marquis Who's Who. She's married to a physician entrepreneur and she has 3 children. One is in medical school and one is going to Stanford, and her youngest is in the 11th grade. And recently, she shared the stage with thought leaders at West Point and with New York Times bestselling health author Suzanne Summers at the Business Expert Forum at Harvard Faculty Club. Welcome, Doctor.
Thank you so much, Tammy, for the wonderful introduction.
Well, thank you. I'm excited to talk to you because you have such a, let's just say, a long career of massive accomplishments, and you are focusing now on functional medicine with a real focus on bioidentical hormone therapy and cutting-edge IV nutrition supplements and pellet hormone therapy. So I have a lot of questions for you. So if you would you just give me an overview of exactly what does functional medicine mean and how it's different from traditional medicine?
Okay, if you go to a doctor, the most common thing is, okay, you're sick. You go to a doctor, you're prescribed a medication, and you come home, pop the pill, expect whatever you went for is improving or it's healing. So it's just a concept that we see, okay, pop a pill for a sickness. And that's not exactly what we do in functional medicine. We try to identify the root cause of the disease and try to reverse it. So if you think a patient is having hypertension and you want to know what are the organs of the body that's causing or behind causing the hypertension is what we would be looking at, try to figure out what are the social, environmental, family circumstances that contribute to a person's health and wellness is our focus. And the focus would be to try to identify those problems that affect the health and try to reverse at the cellular level and improve the overall health of the person. And so that means we are not just prescribing medication. So it's a holistic approach to the health and the well-being, where I identify every factor that can potentially affect the health of the person and try to target each one and intervene and set up a goal plan or like a supplement, and then try to reverse. If those don't help, then we try to go to medication. So the first option for any disease is not just the medical management. We're trying to do a functional management to try to give the body the resources to recover and function better.
So you're really focused on wellness.
Yes.
Trying to help people become well, not wait until they're so far gone that they're in the disease state
process,
but
yes,
to actually to find out what's going on beforehand. I really wanted to focus today's interview on the bioidentical hormone treatment, because I think there's a lot of misconceptions about what that really means, because when I hear the term bioidentical hormones, I'm thinking, well, is that a hormone from a synthetic, something created? Is it from a natural source? So I don't really know what that really means. Could you expand on that and why it's so important that we understand bioidentical hormone therapy today?
Yes, perfect. Okay, so the first thing that we need to understand is that aging is a disease. Aging is caused by dwindling hormones in the human body. Now, for women, we go through menopause in the early 50s when people stop having their periods, they don't have the ovulation, so the estrogen level goes down, they start to have the mood swings, they get osteoporosis. All those because the estrogen is a significant component for these symptoms of prevention. So you get hot flashes when there's estrogen deficiency. It's caused by the vasomotor response of the blood vessels that they get flushed, and you have an intense episode where you feel hot and then you're cold and you're sweating. And the same thing can happen in men too. Now we know that there's something called the andropause where the testosterone levels decrease. And aging, also, we now know that the growth hormone levels can decrease with aging. So these are the concepts that still there's a lot of research, a lot of medical research going on in these fields, because we still don't 100% understand all the biochemical things that happen in the body when we get to menopause and andropause. But at least we know 60 to 70% that is caused by decreasing hormones like estrogen, testosterone, progesterone, pregnenolone, the adrenal hormones. These decrease. So what is bioidentical hormones? So bioidentical hormones, we are trying to simulate what's in the human body at the hormone level and try to give in supplement form naturally derived substances that simulate the same effects. So these are extracts made out of natural compounds that would help you boost your testosterone or the estrogen level. And these are chemically identical, but they're not chemicals. So if you understand, they're not synthetic chemicals. So if you take synthetic estrogen, there's an increased risk of breast cancer. But the bioidentical estrogen does not cause the same effects causing breast cancer. So that's how these are developed. And these are usually done by compounding pharmacies. And usually there's a dosing that needs to be adjusted over 1 or 2 months or 3 months, depending on the patient's symptoms. When they improve, and physically there's like a questionnaire. We rate them initially, and once they start, they improve, and then again they're evaluated in a couple of weeks to see how they are, to see if we need to do any adjustments on the dosing of the hormones. And that's how we progress. And definitely a lot of people find a lot of benefit from using the bioidentical hormones. And, well, it's not like having the synthetic hormones. Now, usually before or even now, we have a compounded cream that you apply with estrogen, the testosterone, then you have the progesterone, the pregnenolone tablets that you can take at bedtime along with the melatonin or any other supplements depending on your symptoms. But now we're also coming up with the compounded hormone pellets. So you can leave the pellet in the body. There's a very minor incision done, and the pellets are inserted into your body. They would give the similar results. And then these pellets last anywhere from 2 to 3 months, and then again you go in for another insertion. Now, these still are not 100% FDA approved in this country, while they are approved in many European countries and other Asian countries too. So we still have that issue with that, but there are definitely proven benefits of doing the bioidentical hormone therapies, either by the creams or the pellets.
So if I take it that most of us are having hormone issues if we're aging, and like you said, both men and women. So do men and women obviously they're different. So you would work with a woman and help her to come up with a hormone replacement plan for her specific needs, and then the same, like if you were working with a man, you would come up with a plan for his specific needs. What are some of the big benefits of having hormone replacement? Let's say that you're already through menopause, and so you're not having hot flashes anymore. What would be some of the benefits?
So usually, so presume you're 60, you've already been through menopause, and you don't have any hot flashes. But then you can have other symptoms of the hormone deficiencies from the menopause, because it's not just one hormone. There is so many hormones that can go down with the menopause. So one is estrogen, one is the progesterone. You have the testosterone that goes down, and then you lose your brain or get into dementia, which seems to be also have a lot of effect from the estrogen. Then you're losing your bone mass because you do not have the estrogen, and you get to a low testosterone, and your energy is super low. You do not have the energy to get out of bed sometimes. And then you have sleep disturbance when your melatonin is low. You can have chronic fatigue because the adrenal hormones can be low. So there are so many other hormones in the body that can go down as you enter into menopause. And these are still improved with the bioidentical hormones. So some of these therapies are not there with the regular allopathic medicine, but the bioidentical hormone treatments do help a person to functionally improve even when they're menopausal at the age of 60, 65, 70.
So it's not too late if you're already through menopause to start this type of hormone therapy then?
No, it's never too late.
Oh, that's
never
good
too
news.
Late.
because I was wondering if there was an age when you should just say whatever. But I mean, I weight gain, thinning hair, your fingernails quit growing, and all of those different things. And I can imagine, just think if you're able to balance out and not feel old and tired, because most of the people I know today in their 50s and 60s and 70s, they're very active and they're not old in any way, shape, or form, except maybe their bodies are starting to slow down. You also do a lot of cutting edge work with nutrition, and I've heard of IV nutrition. What is that?
Okay, so the IV nutritionals, some of them, there are different formulations that we can use. So as you age, and particularly if you see the American diet, right now it's all processed food. There's a lot of processed food, and the shelf life of it from the farm to the consumer, we don't know how long it is. So the nutritional value is pretty much very low. So even if you think you're eating fresh vegetables or something from the store, they may not be fresh. They've been put in the freezer and got to you on the day that you bought it. So they've been out from the farm maybe a week or 2 weeks. And, most of the leafy vegetables, they do lose the nutrient value if they've been put in under storage for a long time. And what you think you're eating is not what you're getting into your body. So if you think you're eating green vegetables and you're getting the B complex vitamins from that, you may not be getting it. So there's a lot of people who have like fatigue, like tiredness, like insomnia. They cannot sleep, they cannot relax, they get anxious. People who have Parkinson's, there are people who have trauma, sometimes chronic fatigue, fibromyalgia. These are all the conditions that we can improve with the IV nutritionals. Even an acute viral illness like flu, okay? If you think about it, if you get the flu, you want to get the Tamiflu prescription, it's $150 and up. So I think the Tamiflu, the brand name, would cost you somewhere around $300. Maybe I just don't want to make one particular example, but anything like that. But the same one, if you give an IV infusion of high-dose vitamin C, you will be better and back to your normal in 24 hours.
Wow.
And that is very interesting. Are we cutting down the cost of the work, time lost from work, and being bedridden for 7 to 10 days with one infusion of treatment? Yes, absolutely, because are these infusions covered by the insurance? They're still not being covered by the insurance. Mm-hmm. There are few supplements they do cover, the B12 and the glutathione. In few conditions they do cover, but not all the time. So and then...
Go ahead. I was just wondering what type of nutrition you could get in the IV, what would be common besides vitamin B12 and vitamin C.
Okay, I'm getting to that.
Oh, okay.
So you had mentioned somebody who had Epstein-Barr virus and had chronic fatigue. So Epstein-Barr virus, I had a patient who would get flare-up almost every month, once every month. And then we had to do him a treatment, which also included dilute hydrochloric acid infusion during the acute episode to kill the virus. It worked tremendously. And every month that he would come with a flare-up, I haven't seen him in about 6 or 7 months now. Okay, so that's the kind of the thing that you do. And then also we give antioxidants. People with hypertension, cardiac disease, diabetes, we can give IV nutritionals, IV antioxidants that help to boost the metabolism, to reverse some of the effects in the blood vessels, to try to improve the diabetes, the hypertension, the cardiac disease. And then we also give multiple IV vitamins can be given. Now, recently also I had a patient who was an 80-plus-year-old lady who had macular degeneration. And I was surprised my treatment would help this lady. She was an Irish lady who had settled down in the U.S. She lived alone. She could not see my hand in front of her before she got this treatment. Now this lady drives by herself, and she's totally independent. I mean, these are the kind of treatments that we want to see that hopefully at some point will become mainstream medicine to help reverse the disease. So we gave her like IV vitamin C, vitamin A, glutathione, also give other antioxidants, the alpha-lipoic acid, that would help her recover her cells back to where it was before, even if it's not 100%, at least 70 to 80%. And then we have patients with chronic fatigue. There's something called the Myers cocktail. There's been a lot of study, a lot of research on this Myers cocktail on how the B complex vitamins and the vitamin C would help patients with chronic pain, chronic fatigue when they have the nerve signals going on all the time, giving them painful impulses. But the Myers cocktail has shown to reverse or some of that symptoms. And that one, I just read an article, even Mayo had done some research on that showed that there's significant improvement in patients with chronic fatigue with the Myers cocktail. So at least the patient will get an infusion maybe once a week or every other week, and they are at a functional level than being in chronic pain and being homebound just because of the pain.
Wow. So how long does, if you needed to have an IV, how long would you be there receiving that treatment?
Okay, the treatment can vary between 20 minutes to about 35, 40 minutes. 20 to 45 is the max. Usually there are some treatments we can just give it via IV push. You have to give a slow drip. So sometimes between 20 and 45 minutes is the average treatment time.
Well, that's really interesting. I hadn't really heard of that, but I can imagine that if your body gets that nutrition that it so needs, that it would help to solve a lot of different issues. So you also have the Pro-Age Institute, and you work with patients in a lot of different ways. Can you tell me a little bit more about how that works, the Pro-Age Institute?
Yeah, the Pro-Age Institute, that's my functional practice. I have also another practice, which is a regular insurance-based practice. This is more of my functional practice where my goal is to try to identify the problem that I see and try to identify at the cellular level and figure out what can be done to reverse the problem. So I had recently, you'll be surprised, I had a young kid, 12-year-old, who's more than 300 pounds.
Oh, my goodness.
But he came to me for a second opinion. I said, okay, let's figure out what we need to do. And he's seen quite a few physicians. Nobody had ever given him an answer what was really happening, and the patients were very concerned. So we had a discussion. Sometimes my intake itself on this integrative side, we have a 17-page form because we really want to see what was the trigger and at what point the body started to react the way it's reacting. So we need to try to identify that situation and try to see from there what can be done to reverse that stimulus that really caused the body to be affected in the way it was. So you identified, yes, it does involve doing some blood testing, the lab testing and all that, at least to have a basic idea. And then clinical exam, more of my forte comes in the clinical exam, trying to identify clinically. We are not just basing or looking at the labs. We are trying to treat the patient for the symptoms that they're coming for. That's exactly what I do. So the focus would be on the person's health and how we can improve and reverse the problem and try to correct the problem. So on this kid, I'm still working with this kid, but it's a lot to do, so I have to dig into the history to try to identify. There's been situations since he was 5 or 6 that had happened that kind of threw him off balance a little bit. So it doesn't happen right away. Sometimes I have to work 1-2 years with the person to try to get them to a balanced, healthy condition before we can say, hey, now I think you're good, and we can try to function at this plan of care. You continue with this plan of care. And we put plans for self goals, then the eating habits, medications if needed. Sometimes we need to exercise, meditation. We even look at alternative therapies like acupuncture, Reiki, stuff like that, that can help the body reverse what is in there. And
so you're really
imbalance.
When you say functional medicine and integrative type medicine, you really are looking at the whole person and looking not only at, okay, this is what is happening, like, oh, you've got high blood pressure, but you actually go in and figure out, well, why do you have high blood pressure and what's going on in your life that may have triggered certain things that attributed to that. And like you said, with the weight issues and things, normally there is something that happens in someone's life that changes everything about how they function. So the ProAge Institute, you also have medical or patient memberships. Can you tell me a little bit more about that?
So I do have, most of the stuff that I do in the functional level, some of them are covered by the insurances, some of them are not covered. So we can have a set fee, or for people who cannot afford to pay all the upfront fees all at once, we have a membership plan that they can pay every quarterly or every 6 months and then continue to see me for the year. And they're guaranteed to at least have one appointment a month. And then they will be seen, try to diagnose the issues. That's for the consultation. So anything additional that can be worked with their insurance, they can get their work with another physician and bring me the report, or I can do the testing for them.
I see. So the membership is, again, it's more, I think, the future of medicine, because when you're a member of ProAge Institute, you actually, like you said, you have a minimal waiting time. You get to see the doctor. You don't have to wait to be sick, because I know, like me, I'm thinking about, I'm not necessarily sick, but I know that I probably have my hormones are probably off. I know that much because, I read a lot and I can kind of put 2 and 2 together. I don't need a doctor to tell me, oh, you probably need to see a doctor. I probably know that much. But I really like the idea of the medical membership because of the fact that, again, you're operating for wellness, not necessarily, oh, I'm sick, now I have to go see the doctor. But let's look at how we can keep you well and keep you living longer and healthier and reverse any signs of aging and things. I think, isn't that one of the key things about functional medicine, that you're looking at making it so that you can reverse some of the damage that has been done, and so that people will live longer, healthier lives? I mean, if you're able to pinpoint the issues.
Yes, exactly. So what we are looking at is trying to have the person age healthier, okay, and then stay well as they age and not be sick. The goal is to age healthy and well.
So that when you do eventually die, you just die because you're old. And it's time.
That is true.
Well, because, it's always interesting. And luckily for me, I'm hoping that I get I received the health from my father. My dad is 91. My mother only lived until she was 59. But as I learn more, I know that more than likely if she had been treated in a different way, she probably would have lived a lot longer because I think things she had wrong with her were treatable if they'd been caught sooner. But my dad, luckily, he's been eating, he eats well, eats a lot of homemade food. He grows his own vegetables. So I can see that he has actually contributed to his own longevity just because he's paid attention to eating better and, being healthier. So if somebody wanted to talk to you more, what is the best way to reach out to you, Doctor?
Okay, they can look at my website, proageinstitute.com. And if they would like to set up an appointment available, they can send me a message through the website, or they can call the number 832-532-0040, and then schedule an appointment with me where they have dedicated time to talk to me with all their concerns about their health and wellness and try to come up with a plan to keep them well into the future.
Well, thank you. Well, I'll invite you back another time to talk because I'm sure we could talk about all kinds of the latest health technology issues and ways to, for example, I'd love to talk to you about, more about hormones, more about weight issues, and about all of the different things. So thank you so much for taking time with me today.
Thank you, Tammy. Thank you so much, and have a wonderful day.
This is Tammy Patzer. Go make it a beautiful day.
You've been listening to the Thought Leaders Show. To get all past shows and to get all future shows, go to thoughtleadersshow.com.